Well, when you look at comorbid conditions that accompany Alzheimer's disease, the most common happen to be um, hypertension, osteoarthritis, depression, diabetes, coronary, and cerebrovascular. It's remarkable that 4 out of the 6 are related to vascular disease. Other studies from Europe have also shown that cardiovascular related conditions are the most frequent comorbidities in patients with dementia. And furthermore, when they are synergistic with other conditions such as chronic pain, depression, hearing loss, constipation, or diabetes, in terms of increasing a person's risk for eventually developing dementia. And when you look at the various risk factors, there's some good news and not so good news. In this study of 215 subjects without cognitive impairment, mean age 62 years, who were cognitively intact, both amyloid and tau deposition were associated with total cholesterol, LDL cholesterol, systolic blood pressure, pulse pressure, and the Framingham risk score for cardiovascular events. This was true in patients not on medications, but medications seem to disrupt these associations, giving us hope for an opportunity to prevent this progressive deteriorative disease. A couple words about vascular dementia. From a historical perspective, in 1910, Kraepelin concluded that arteriosclerotic insanity was the most frequent form of senile dementia. Since then, there's been multiple names, including multi-infarct dementia, ischemic vascular dementia, arteriosclerotic dementia, cerebrovascular dementia, and even ischemic vascular dementia. There are variable diagnostic criteria, but in general, vascular dementia is associated with a stepwise progression, with prolonged plateaus or fluctuating courses, and there are focal cognitive deficits that may not necessarily involve memory impairment. There's often impaired executive function, that of problem solving or even judgment, and the diagnosis of vascular dementia is strengthened by imaging studies showing ischemia or the history of cardiovascular risk factors or atherosclerosis in other vascular territories such as the coronary arteries or peripheral arterial disease. Vascular dementia can be categorized into several categories. Large vessel vascular dementia is temporally related to stroke, and there's usually concomitant depression. Small vessel vascular dementia involves frontal lobe defects, executive dysfunction, inattention, depression, abnormal gait, sometimes Parkinson's syndromes, and once again, memory impairment may be less pronounced. Then there's ischemic hypoxic vascular dementia and hemorrhagic dementia as well. Irrespective of the exact cause, vascular dementia may be viewed as a cascade of events with vascular risk factors resulting in cerebral vasculature damage of multiple distinct pathologies, large vessel, small vessel, hemorrhage, or hypoperfusion, and these create a final common pathway to vascular dementia with damage to critical, cortical, and subcortical structures and interruptions in the circuitry of the brain. To balance out the discussion, because cardiovascular disease increases with age, it's been suggested that cognitive decline seen in patients with progressive dementia may lead to worsening self-care and a greater risk of cardiovascular disease. This is in one study, patients with dementia were found to be at greater risk of cerebrovascular disease rather than cerebrovascular disease, conferring a greater risk for dementia. And this is a very fertile area for investigation at present. Nonetheless, I hope that I've made a compelling argument that dementia is indeed a vascular disease, as the majority of patients with Alzheimer's disease, a disorder that is traditionally viewed as neurodegenerative, has a vascular etiology. In fact, 80% of all Alzheimer's disease patients' brains have evidence of significant vascular pathology. And I wonder if the 20% that don't really do, we just haven't looked for it in the proper ways. Evidence for impaired cerebrovascular reactivity, even in preclinical Alzheimer's disease. And moreover, cardiovascular risk factors are prevalent in patients prior to dementia and in those with neurodegeneration prior to clinical manifestations.